Dysentery has been known to humans for thousands of years, with the earliest recorded descriptions dating back to ancient civilizations. The disease was first described in ancient Egypt around 1900 BCE in the Ebers Papyrus, one of the oldest preserved medical documents. It was also known in ancient Greece, where the physician Hippocrates, 460 to 370 BCE, wrote about the symptoms and treatment of dysentery. However, the specific causative agents, bacteria or amoebae, were not discovered until much later, in the 19th and early 20th centuries. Dysentery is primarily caused by two types of pathogens: Shigella bacteria, which cause bacillary dysentery, and Entamoeba histolytica, which cause amoebic dysentery. The infection spreads through the fecal-oral route, which means that it is transmitted when someone ingests food or water contaminated with feces containing the pathogens. The common pathways of infection for dysentery include contaminated food and water. Consuming food or water contaminated with Shigella or Entamoeba histolytica can lead to dysentery. The contamination can occur due to poor sanitation, improper handling of food, or contamination of water sources. Person-to-person transmission. Dysentery can spread through direct contact with an infected person or through contact with contaminated surfaces or objects. This can happen when proper hand hygiene is not maintained, especially after using the toilet or handling contaminated items. Flies. Flies can act as mechanical vectors, transferring the pathogens from contaminated feces to food or surfaces. Fecal contamination of hands. If someone with dysentery does not wash their hands properly after using the toilet, they can spread the infection by touching objects or preparing food. To prevent the spread of dysentery, it is important to maintain good hygiene practices, such as hand washing with soap and water, properly treating drinking water, and ensuring safe food handling and preparation. Additionally, improving sanitation and providing access to clean water can help reduce the risk of dysentery outbreaks in communities. Dysentery is an infection of the intestines that causes severe diarrhea with the presence of blood and mucus in the feces. Symptoms of dysentery may vary depending on the causative agent: Shigella bacteria for bacillary dysentery or Entamoeba histolytica for amoebic dysentery. However, some common symptoms include diarrhea, frequent, loose, and watery stools, often containing blood, mucus, or pus; abdominal pain and cramping. Discomfort and pain in the lower abdomen, along with cramping, may be experienced by individuals with dysentery. Fever. A mild to moderate fever may accompany dysentery, especially in cases of bacterial infection. Nausea and vomiting. Some individuals may experience nausea and vomiting as part of the infection. Urgency and tenesmus. A feeling of urgency to pass stool and a persistent sensation of needing to pass stool even when the bowel is empty, tenesmus, can occur. Dehydration. Prolonged diarrhea can lead to dehydration, which may cause symptoms like dry mouth, increased thirst, dark urine, weakness, dizziness, and reduced urine output. Fatigue and weakness. Dysentery can cause general malaise, fatigue, and weakness due to the body's immune response to the infection and loss of fluids and electrolytes. It is important to seek medical attention if you suspect dysentery, as complications can arise if left untreated. Proper diagnosis and treatment are necessary to prevent complications and ensure recovery. Treatment for dysentery depends on the cause of the infection, as well as the severity of the symptoms. The main goals of treatment are to manage symptoms, prevent complications, and eliminate the causative agent. Some common treatment approaches for dysentery include rehydration. Replenishing lost fluids and electrolytes is crucial for patients with dysentery, as dehydration is a common complication. Oral rehydration salts, ORS, can be used to help replace fluids and electrolytes lost through diarrhea. In severe cases of dehydration, intravenous, IV, fluids may be required. Antimicrobial therapy. For bacterial dysentery, antibiotics may be prescribed to target the Shigella bacteria. Commonly used antibiotics include ciprofloxacin, azithromycin, and ceftriaxone. For amoebic dysentery caused by Entamoeba histolytica, antiprotozoal medications like metronidazole or tinidazole are typically prescribed. Supportive care. Over-the-counter medications like acetaminophen or ibuprofen can help alleviate fever and pain. However, it is important to avoid using antidiarrheal medications such as loperamide or diphenoxylate, as these can worsen the condition by slowing down the elimination of the causative agents. Rest and nutrition. Proper rest and a balanced diet are important for recovery. Patients should consume easily digestible foods and avoid spicy, greasy, or high-fiber foods until symptoms improve. Gradually reintroducing solid foods and maintaining good nutrition can help promote healing and recovery. Prevention of spread. Practicing good hand hygiene and proper sanitation can help prevent the spread of dysentery to others. Washing hands with soap and water after using the toilet, before preparing or eating food, and after caring for someone with dysentery is essential. It is important to seek medical attention if you suspect dysentery, as timely diagnosis and appropriate treatment are necessary for recovery and preventing complications.